Okay, we're going to get started now. So thank you so much, everyone, for joining us this morning for our Nurturing Equity, Understanding Lactation Accommodation, and Paid Leave Rights for Home Visitors Supporting Families. This specialized training addresses the essential topic of lactation accommodation and paid leave rights tailored for home visitors who support families. It navigates the intricacies of accommodating lactation workers, particularly in the context where resources and space may be limited. Furthermore, it examines the rights of immigrant workers and those in non-traditional or difficult workplaces, clarifying their eligibility for paid leave and avenues for resources if their rights are infringed upon. We're very excited today to be joined by 3 organizations. So we're joined by BreastfeedLA Coalition, California Breastfeeding Coalition, and Work and Family Coalition. During our training today, we will talk about lactation accommodation rights. We will talk about paid leave rights for low-wage and immigrant workers. We will learn how to support families efficiently. And then we will also learn about how to utilize the BreastfeedLA's Know Your Rights Toolkit and other resources to advocate for working families. With that being said, I'm super excited to announce our first speaker, Natalie Akins. Natalie Akins is a continuing education coordinator with BreastfeedLA. Natalie is in her final year at Claremont Graduate University studying public health and positive health psychology. As a graduate student, she worked at the Empower Center, her on-campus resource for students impacted by interpersonal violence. She focused on student programs linking mental health promotion with interpersonal violence awareness and prevention. She was also a Randall Lewis Health and Policy Fellow, where she interned with BreastfeedLA. Inspired to continue working in reproductive health and lactation justice, she's eager to continue her work at BreastfeedLA's continuing education coordinator. Natalie, thank you so much for being with us this morning. I'll hand it to you.
Thank you so much. Good morning, everyone. I wanted to briefly share where you can find BreastfeedLA's Know Your Rights Toolkit. Just for both your reference and also to share with your clients. This toolkit was co-authored with the ACLU, SoCal, and California Women's Law Center, and it was created to support and empower individuals to advocate for themselves or others across California, and it's been updated with all recent laws that have been passed since 2017. So from our website homepage, breastfeedla.org, you can navigate to the Parents tab, and then we have the Know Your Rights Toolkit listed. And so we offer this toolkit in both English and Spanish. So if you click on this image here, you can have access to the entire toolkit. And I'm going to go back, but to show that if you are looking to answer like a specific question, you can scroll down to where we break down each section in this portion. And so, for example, if your client is a new adolescent parent and you want them to know lactation rights they're entitled to at school, you can select the selection on breastfeeding in the education system. And it will show you the section specific to this specific to the rights this student is entitled to. And this way, if you just need a specific question, you're able to do this. And then we also offer sections on the 6 key laws for working parents, breastfeeding at work, and lactation accommodations you're entitled to, breastfeeding and lactation accommodations for if you're on jury duty, breastfeeding during divorce or custody cases, lactation rights while you're incarcerated or if you're in an immigration detention center, lactation rights for adoptive and foster parents, lactation rights in surrogacy, lactation rights for LGBTQIA families, your rights if you need to know if you want to breastfeed in public, and then also your breastfeeding rights in a medical care center. And then we also give information on how to advocate for yourself. As well as the EDD digital toolkit. And so I encourage you all to explore the toolkit and utilize it for your clients to advocate effectively for lactation rights. You can also find, if you keep scrolling, this is where you can find the Spanish version of the toolkit. And we also have each section laid out as well. And then if you would like to learn more ways about how to advocate and practice role playing on how to advocate effectively, you can also join BreastfeedLA for our in-person Know Your Rights training. If you go to the parents and then, sorry, professionals and under Advocacy Day 2024, you can find the link to the registration. And this Know Your Rights training is on August 29th and 30th, and it will be a 2-day event at the California Endowment that will bring together community members and professionals to explore crucial topics affecting families and their childbearing years, such as birthing people's rights, paid family leave, and lactation rights. And we're offering continuing education credits to both RNs and IBCLCs. You can find more information by clicking on this Register Now button. And we also have the agenda and the speaker information on this page as well. And so by attending this webinar, you qualify for a 10% discount off your tickets, which the code will be shared with after this webinar. So thank you all for your attention, and please don't hesitate to reach out to me. My email is nakins, AKINS, @breastfeedla.org. And if you have questions or need further assistance, you can contact me. So thank you.
Okay. Good morning, everyone. I'm going to be introducing our next speaker today, Robbie Gonzalez-Dow. She is a seasoned public health professional with more than 30 years of expertise in maternal and child health advocacy and program management. She has been notably in advancing breastfeed and supporting policies. She's been instrumental in driving policy reforms, workplace lactation accommodations, and healthcare practices, including initiatives benefiting incarcerated individuals. She was formerly the executive director of the California Breastfeeding Coalition and achieved many milestones like workplace lactation accommodation legislation passage and comprehensive breastfeeding guidelines for community care clinics. And she is currently working as a manager for California Breastfeeding Coalition, where she leads virtual WIC breastfeeding education trainings for 4,200 staff and collaborates with WIC leadership on breastfeeding initiatives. She additionally serves as a program coordinator for the Maine CDC Maternal and Child Health Program, pioneering a statewide cytomegalovirus newborn screening program. And Robbie's passion for better healthcare outcomes and community empowerment drives her commitment to a healthier and more inclusive future for families across diverse settings. So I'll pass it over to Robbie.
Thank you. And good morning. I'm so happy to be here today to provide you with a deeper understanding of lactation accommodation in the workplace so that you can support mothers and parents to overcome their challenges of returning to work and continuing to provide their milk to their babies. The information I am providing today is public information, but I do want to give credit to the USDA WIC program. It's our federal WIC program for sharing the breastfeeding curriculum. I'm using many of the slides that address lactation accommodation. And while I'm speaking, please put questions in the chat. I'm really going to go into detail about what the protections are. And so if you have specific scenarios, please put those in the Q&A also. And then I think we'll have some time to go through those. So we'll go on, and during this presentation, if you find that you have legal questions, you can go to the next one, Anna. So if you find that you have legal questions or find that your clients need legal support, I recommend that you contact Legal Aid at Work or the Center for Work-Life Law. I've provided you with their contact. You'll get a handout after the workshop and their information will be there. Those are the two kind of go-to that we go to when we have questions about lactation accommodation and just need some clarification. And they have hotlines that you can give to clients, and they'll respond right away. So to the next slide, I feel passionate about this issue because in California, we have some of the strongest lactation accommodation rights in the workplace. And so many moms and parents, they're not taking advantage of these rights for various reasons. And I want to make these laws, the lactation accommodation rights, real for all moms and parents, regardless of the reasons and where they work. That really is a passion of mine. I'm going to go ahead and you could go to the next screen, Anna. If you can take a screen, scan the QR code there, or go to Menti and put the code in menti.com and use the code 449366677. I want you to enter, you can enter up to 3 reasons why you think moms and parents don't pump at work. I'd like to see what you think. What are you hearing from people? Uncomfortable. I'm going to be looking up just a little bit because I have another screen up there. Embarrassment, no time, judgment from others, hassle, lack of privacy, no place to pump, unaware that they can, inconvenient, no space, not allowed. Some of these I know are definitely fixable because we have protections. No time for pumping. Okay, there's a lot of reasons. Too busy, the accommodations, inconvenient. So you're hearing everything. You can go ahead and start sharing again, Anna. Yes, a lot of reasons. So with these reasons, you know, when people are going to hear a lot of the benefits. So the benefits during the pregnancy, they're hearing a lot about the benefits, and they sound good. And they're like, okay, I believe in these benefits. The cost to breastfeed, lactate's not too high. But then we see all these reasons. Then real life comes in, and the baby's here, and then people have to go to work. So when these reasons and other barriers, they start to weigh more heavily. And this can make the benefits less important. I don't know if you could click one more time and we'll go, so you can see how it starts to now weigh the other way. The costs are just too high. Yeah, the benefits were great, but now they're just not as important to the parents. So that it can make them less likely to breastfeed or chest feed, helping them find solutions to the reasons and barriers you identified to not pumping at work increases the likelihood that they will pump at work. Sometimes people just need someone to talk through these concerns and have some hope that, wow, there's actually something I can do. So your role as a home visitor is so important. I can't emphasize that enough, to be that trusted person, to listen to their concerns and to support them. So on the next slide, I'm going to show a video. I'm going to show you this video. It demonstrates the possibilities to pump at work. It is an example of the work of agriculture. And you may not serve many people who work in agriculture, but I want you to see the possibilities to support outdoor work environments and how the laws can be real for all employees who desire to pump at work. And when you view this video, if you can just notice how the employer supported employees to pump at work, and I'll have you put some of this stuff in the chat. We'll go ahead and play.
Writer-affiliated companies in California employs up to 4,500 workers, mostly women, to grow and harvest berries. Their challenge in supporting nursing employees is where to find space in the huge open fields. Their solution was easier than expected. They partnered with local resources to provide pop-up privacy tents and privacy car visors for women to express milk. Their Employee First policy assures that women are respected and supported.
The lactation support service provided for our field employees, especially our females at this time, which is implemented this year, what our intention was to help them come back to work early. The way it works is with the help of WEEK, we wanted to write out a policy, implement it, train our crew leaders out in the fields, and train our employees as well, and this is done during the orientation.
For me, it's not a problem. Out here, I have the crew basically like a family. A lot of the women that are out here in the field that have had babies this year and last year have about 6 years working for me. It's not a problem. They actually do it accordingly in their lunches and their breaks. And if there's any reason that they have to take an extra 10 minutes, I don't think it's any problem. It's the health of the baby that's the most important thing.
The biggest challenge that we faced at implementing the policy was just the area for them to pump, and the privacy was our main concern. And it's just a matter of like communicating and getting the right tools. And I think we did a really good job. Like I said earlier, we have our employees, we give them the option that they can use the vehicle for their private vehicle, or they can use the vehicle for the company, which is the crew leader who drives the vehicle. So we provide them the shelter within the car. We also provide them tents. So that's another neat thing that I thought it was really interesting, because it's more private. It's more private for them, and it's a way for them to feel more comfortable. So I think that was the biggest challenge for us, just implementing it out in the field. We feel that this is going to promote a healthier awareness within our employees. We feel that this accommodation is also going to increase our return of our harvesters, because a lot of them take a long time to come back. We have a couple of incidents or a couple of employees who actually take about a year off of work. And I'm sure it's because, they're lactating, that they want to, that special bond and take it a little bit an extra step. And I think this accommodation is also going to benefit them, and it's going to benefit us by having more employees, especially right now in this shortage that we have with our ag industry. It's going to be awesome for us to bring back all of our employees, and especially our females.
I didn't need to come back to work this early. I still had 6 more weeks of maternity leave. I could have used that. I work at the blueberries. That's what I've done for 3 years, and I happen to like picking blueberries. So if I hadn't been able to pump my milk, I would have stayed home, because I had already made a decision to breastfeed my daughter for 6 months, and she was 3 months old, and I would have stayed home and reached my goal and not come to work. If they weren't going to be willing to help me out with this, I was not going to come this season. I'd come next year.
That's what I'm most proud of, that they can able to achieve what they need to achieve out here, healthy for the baby and healthy for them too.
Having access to privacy while breastfeeding my baby is very important. I really appreciate that they have given me the opportunity to safely accomplish my breastfeeding goal. Being able to return to work early is great, but the health of my baby is the most important thing to me.
I'm so pleased that Riders is supportive of the moms who worked in the field.
It's a way to promote health. It's a way to promote family bonding, and it just makes it easier for the family to get together, and easier for us too, because we are a family-oriented business.
And you can have healthy mom, healthy baby, healthy workforce.
I saw some questions. Yeah, those are some of the benefits there. Oh, good for business. If you can write in the chat one way you noticed how the employer supported the employees to pump out work. And I noticed a question about what to do in hotter months. This was in the Watsonville area, and it does get hot there, actually. Under those hoops, it gets pretty hot. She actually preferred to use her car, and she had the air on the whole time. So the tent might not be the best choice when it's really hot. the new legislation actually does, I didn't put it in here, but it does have that for ag, they do need to provide, they need to be in a cool space. So there is some consideration for that. So there may be different options. If it's in a car, we can turn on the air condition, or maybe they're placed in a different environment if they have an indoor type of, maybe it's a packing shed or something like that. And I could get where those tents are because they can be used in other situations if the person feels comfortable who's pumping. Sometimes when people hear sound and they know other people are in the same place and they're still in the tent, they might not be comfortable. So it really depends on the person. But the women at this, through the WIC program, actually came up with these solutions that you saw here. Okay. Anything in the chat?
Yes, there's actually one more question that came through. I'm not sure if you'll know this, Robbie, but someone asked, how was the electricity provided? The movie showed an electric pump case being carried out of the tent.
So they used, we were able to access pumps that had a lithium battery. So they just plugged it in at night, like your cell phone, and then they were able to use it the next day. So that was available. And our Medi-Cal managed care insurance in that area paid for those pumps. And the WIC program also had a supply. So the whole community really kind of came together, like how can we support people who work in the fields and make this happen? So that was pretty exciting. Let me tell me if you see others, but I'll go ahead onto the next slide and get into the details of the law. So we have two sets of laws that provide protection to lactating employees in the workplace. We have the California Labor Code, and it's 1030 to 1034. That's the number of it. And we have the Fair Labor Standards Act, and you'll see it called FLSA. And this covers the entire nation. So this is a federal law. And they're very similar in many ways, but in some areas, one may provide greater protections than the other. So in that case, when the laws are different in areas, the law that provides the greatest protection is the law that protects the lactating employee to pump in the workplace. So we look at the two because the federal law says that anything in state law or local laws, like San Francisco has their own law for the city and county there, that if it provides greater protection, the federal law won't preempt that. So we look at both and then which provides greatest protection. So I'll let you know as we go through these. So on the next slide, this just shows you all the different industries that are required to provide lactation accommodation. So the state and federal laws do differ a little bit in this area. In California, all employers or all employees have legal protection to pump, to break time, and a private space to pump at work. So all employers should be accommodating employees. No industry in California is exempt from providing lactation accommodation in the workplace. At the federal level, certain employees of airlines, railroads, and motor coach carriers are currently not protected to pump at work. Not everyone who works there, but just a certain class. But however, this may change soon. And if you want to learn more about it, it's in the transportation area. If you want to learn more, in your handout that you'll be provided, I have a link to a handout that specifically explains those details with that industry. So break time protections. Both, on the next slide, both the state and federal laws provide break time protections to pump at work. In California, every employer is required to provide a reasonable amount of break time to accommodate an employee to express milk at work each time the employee has the need to express milk. And this is very similar to the federal law. The difference is this is not limited to only 1 year after the child's birth, like the federal law. The federal law is very clear that it's up to the child's first birth, that they have those protections. California law does not state a limitation on how long an employee can have break time to express milk at work. So Right now, the recommendation from the American Academy of Pediatrics is to provide human milk, breastfeed until 2. And so in California, people are protected. They can continue to pump out work. It will change. The frequency and duration of breaks needed to express milk will likely vary depending on factors related to lactating employees and their child. If somebody had a preemie, they may be dealing with supply issues. They may need to have more breaks. If somebody has a 18-month-old or a 2-year-old, they may not be pumping as much. I know someone who their child won't drink their milk, but they want to nurse at the breast, but they will not drink it. So she continues to pump out work really just to maintain lactation. And when she's with her child, and then she direct breastfeeds. So everyone's going to have a different kind of situation. And an employer cannot deny an employee a needed break to pump. In California, it is preferable for the employee to pump during the regular paid break time already provided to them. So many of us work 8 hours a day, and we get 2 paid breaks, and they're usually about 15 minutes. And then we have our unpaid lunch break. So that's really when in California, they'd like people to take their lactation breaks while they have that paid break, and then to pump at their lunch. Because any additional break time needed after that, it does not have to be paid. So that's an issue. As long as the employee does not perform any work, as long as they don't perform any work during those additional breaks they may need. If they're doing any work during the break, then they have to be paid. They must be paid. So maybe they're sitting there answering emails, work emails, or they're answering phones because they put a phone in the lactation space so that people could do some work. Well, they're not really off of work then, so they do need to be paid. Employees who telework are eligible to take pump breaks on the same basis as other employees. So now we'll go into private space. And all employers in California must provide employees with the use of a room or other location other than a bathroom. And the space needs to be in close proximity to the employee's work area. It needs to be shielded from view and free from intrusion while they are expressing milk in private. And this may include the place where the employee normally works if it otherwise meets those requirements. Maybe they have their own office, or the cubicle's in a place where it just works out that they can pump there, and they put some kind of curtain. It really just depends on the work situation. So next we'll go into some of the requirements. The lactation room or location must be, and this is very clear in our state law, clean, safe, clean, and free from hazardous materials. Contain a surface to place a breast pump and personal items. Contain a place to sit and have access to electricity or alternative devices, including but not limited to extension cords or charging stations needed to operate an electric or battery powered breast pump. So there's a lot of flexibility for all workplaces to make this work. And this is a really nice place at the LA Department of Water and Power. And you see that they used a curtain to make some privacy. So it was probably a bigger space that they said, hey, how can we make this private and accommodate our employees so that they can pump out work. So there are 2 other requirements in California that exceed what the federal law requires, and employers in California must provide access to a sink with running water and a refrigerator suitable for storing milk in close proximity to the employee's workspace. So this is something that's newer, and the employer has to provide this. So let's look at some different spaces. So there's a dedicated lactation space, and this is a single dedicated lactation rooms. They're often set up in companies where there are many lactating employees who might need services. This one is really unique. So this is a business that took a corner and just put a wall to corner off an area, and they made a private space. So you see the chair is in there. It's big enough for the chair. And then on the next page, you'll see a little table. But if the business does not have a lactation room and the need is great, suggest the employee talk with the employer about creating a simple space, something like this. It's possible to convert an office area, storage room, a closet, or other small space. Temporary spaces. A space for pumping may be mobile or temporary. Employers may address space requirements in different ways, and you can see in this way, it's in a big kind of a conference room, and they use these. I like these mobile walls because they're easy to move around and they do provide privacy. So in non-office settings where space is not available for a dedicated lactation room, employees may find flexible options. And if we could just go back to that one slide. So the conference room, an employee break room, a conference room, or other locations. Recently, BreastfeedLA shared that they had a mom who worked at, I believe, I'll say fast food, I won't say the place. And they were using something temporary. You'll see in the next, the tent. This is using screens and dividers. So they're making a smaller space within a bigger space. And I like that. And the other thing is employees need to be given priority. So if they're using something like this, or if they're in a room, they do need to be given priority in these flexible solutions to be able to schedule their milk expression break so that other staff can work around their needs. For the person who was in the fast food situation, it was private. They had a tent like this, but that people were walking in, and that just did not help them to relax. So they advocated for themselves to, could the door be locked at this time? And those are all reasonable requests. She wasn't asking for anything out of the ordinary. So these indoor-outdoor solutions, they do have to be functional as a space for pumping, including that the space must contain a place for the employee to sit and a flat surface other than the floor on which to place their pump. And you can see this chair makes that happen. It's a chair you could get at a camping store, and it has a nice table on the side, and the pump fits there. And they want to be able to stand. So in this pop-up tent, for example, it's tall enough that somebody can stand, and it works pretty well. So teleworkers, again, they also must be free from observation by any employer, provided or required video systems, including computers, cameras, security cameras, or web conferencing platforms. Next, there's a requirement in California. California Lactation Accommodation Law also requires employers to develop and implement a policy regarding lactation accommodation. And the policy should include a statement about an employee's right to request accommodations, the process by which the employee makes the request for lactation accommodation, the employer's obligation to respond to the request, and a statement about the employee's right to file a complaint with the labor commissioner for any violation for the lactation accommodation law. And the employer should include the policy in an employee handbook or set of policies that the employee makes available to all the employees. And the employer shall distribute the policy to new employees upon hiring and when employees make an inquiry about requests for parental leave. And employers should provide a written response to the employee if they can't comply with the policy, if they say, we can't. Get it in writing. So that is something that is required, and it makes it very clear about the process. So starting the conversation, and starting a conversation about lactation accommodation needs to, about those lactation needs can be intimidating for employees. Sometimes people think that the worst, that they're not going to be supportive. But communicating with your employer is so important because they can't read your mind. They're not sure what you're going to do. But encourage moms and parents to ask about the lactation policy. This is a perfect way to start a conversation, especially in California, since it's a requirement. They may not have one yet. So you could ask about their HR, the HR department or the supervisor about the lactation support needs before the baby is born, but start with that policy. And some questions the employee can ask the employer before having the baby are like, what private space is available for expressing milk? How should I arrange my schedule? So you're talking about the private space and time, break time. And then where should I store my milk? Because they have to provide storage. So those are some things that they could start with. And ideally the policy should address these questions, but they may not. I've seen some policies where they just repeat what's in the law instead of really spelling out what happens in that workplace, in that business. So this conversation gives employees time to consider the employee's needs and prepare adequately. Employers do appreciate having lead time to consider options for making arrangements, especially if they don't have a dedicated lactation space. And I would encourage all of you to role play this conversation with your clients to help build their confidence. It's always helpful to have that role play. And I'm going to put, I think I didn't put this in your handout. I'll put it in, I'll give it to the host right now. So I think I can't directly message you something. That link there does have some good questions in how to talk to an employer. It's from Center for Work-Life Law. And it goes, what I like about it is that it states you may have to educate your employer, which I have seen. The employers don't really know much about lactation. Even though we've had our laws for quite a while, they may not have had someone ever request lactation accommodations. So sometimes there is a little bit of education of why pumping is important and how it's important to the person and that it's the law. So we're going to watch another video. This one's of Carl's Jr. And this was up in Sacramento.
Carl's
If in the chat, if you could put how this employer supported their employee.
Jr. shows that it's not hard to support nursing employees, even in small cramped space and in the hectic pace of a fast food restaurant. The company offers a small storage area and rotating schedules so nursing women can easily express milk at work. The management and the employees' team approach respects and values nursing employees.
I have helped some of my employees by returning back to work from maternity leave and leave of absence by allowing them to pump breast milk.
My goal is for 1 year to breastfeed.
Numerous of them have came to me and asked me questions of how they would go about doing so, pumping at work, and I just tried to provide them a designated area where they feel safe and secure to be able to express their milk.
She's very supportive. She's actually excited that I am breastfeeding.
As an employer, I feel that it benefits the company or the employer to allow the mothers to pump breast milk because it uses less time and money having to hire and train new employees because you couldn't accommodate your existing employees to be able to support them in a positive manner. I think it also helps with allowing employees to pump breast milk because it sets a positive morale in the restaurant, and then you have happy, quality, productive employees working for you.
Just don't be afraid to ask if you can pump at work, during work, break times. There's a lot of people on the clock, so there's enough time where I can sit down and we have to take our breaks.
It makes me feel very proud because I'm contributing to their life success, not only as them as my employee, but as their children, which is our future. And then it makes me proud too to know that they can feel comfortable coming to me and talking to me like that we can communicate and work together because we are supposed to be a team.
If I wasn't able to pump at work, I would volunteer to quit. I wouldn't want to because I love my job.
I think as a fast food industry, being very fast-paced, short, limited space areas, having 4 lactating mothers at one time being able to pump breast milk, that if we can do it as a company in fast food, that any company in any industry could be able to do it the same.
Thank you. Go to the next slide. So regular pumping breaks are necessary to avoid severe pain, risk of infection, and risk to someone's milk supply and other complications. And I have talked to people, one stands out to me where they weren't getting their regular breaks because there were several people that needed the room. And every time they went, someone was using it, but the employer wouldn't let them develop a schedule so that they could all work together and decide who can use the room and when. And she lost her milk supply, and she was really mourning over that and called and said, wanted to know if maybe they had done something wrong. And I think later she ended up making a claim, but it was, I actually sat on the phone with her. She was crying. I was crying with her because it was such a loss to her. And this is what she really wanted to do. And this was a pretty big company too. It wasn't fast food. And so people really do need support, just really at all levels, because it is a time when people just need a lot of support and to be able to talk through things and get the correct information. But that losing that milk supply is what definitely can happen. So most lactating employees need to express milk every 2 to 3 hours or 2 to 3 times in a typical 8-hour work period. And it helps if they pump at the same time every day at work to maintain their milk production. And I think that's helpful because then it's predictable. It's not, the employer knows maybe if they need to cover them for that break and when that will happen every day. Most lactating employees will need around 15 to 20 minutes to express milk plus time to get from the milk expression area, especially if it's not really in close proximity to them. And some need a little longer if their milk does not, we call it let down easily or release easily. Lactating employees should talk with their supervisor about the time needed for them to express breast milk and options available to them. Remind them that breastfeeding or chest feeding the baby directly at the daycare provider immediately before and after work will give the baby 2 extra feedings for the calories they need and to help maintain their milk production. If you can go to the next slide, I have some sample pump schedules, and this will be in your handout. But this one's for a day work schedule. So they leave baby with the child care provider at 7:15 in the morning, and they breastfeed the baby before they leave for work. Then they arrive to work. And this is all going to be different depending on where you live in traffic, but this is just a general kind of thinking about it. Then they have their break and they'll express milk for 20 minutes. Then at their lunch break, they express milk. And then again at 2, they have another break. And then at the end of the day, they go to get their baby and they breastfeed at the child care provider. And then when they're with their baby at home, they just breastfeed on demand with the baby. The next schedule shows a split shift. So they leave the baby at 10 in the morning, 10:30 in the morning with the child care provider. They breastfeed the baby before they leave for work, and then they arrive at their first shift. And then they leave after the busy lunch period, and they go to the daycare provider. They go there, breastfeed the baby, and then they breastfeed again before they leave to go back for their dinner shift. And they express there one more time, and then at the end of the day, they go back with their baby and they will nurse the baby again. The next one is an afternoon evening shift. And this one is they're at home and they breastfeed on demand with the baby. 12:30 in the afternoon, they leave the baby with the child care provider and they breastfeed before leaving for work. They arrive at work, and then About 2 hours later, they'll have a break to express milk. Then at their dinner, they'll have a break, and then again later at 8:30, and then again 2 hours later, they'll go get their baby. They'll breastfeed there, and then they'll nurse with their baby on demand when they're at home. So it's just some different ways to see how a schedule can be flexible and works for different workplaces. I want to mention one thing just about childcare, because I was doing a training yesterday, and it came up a lot where people are being told by the childcare providers, no, you have to bring formula. They don't want to touch, they say that the breast milk's the bodily fluid. That's correct, it is, but it's not a hazard. It's not going to cause them any infection. If they want to wear gloves, they can wear gloves, but they should not be denying people's breast milk to give to that person's baby. So just so you know, it's not a hazard, and they shouldn't be doing that. If they're participating in the child care food program, or they get reimbursed for meals, they can get reimbursed for someone sitting there nursing their baby. So those federal regulations have changed. And if the lactating person provides their breast milk to the daycare provider to be given to the baby, they can also be reimbursed for that. So those barriers have been taken away, removed. So we'll go on and we'll talk about options for extra time. So lactating employees find that they need extra time to get to and from the private milk expression area, set up the pump, clean the pump, and even to express milk itself. So first, the time needed to get to and from the milk expression area, that should not be counted as part of their break time. The break starts when they get to the private space. And if possible, could they keep the pump set up in that private milk expression area? Is that possible? Or to keep it close by? Could they have more than one pump kit so that they don't have to spend time washing pump kits? Could they just put it in a bag and then put that bag in the refrigerator with other things, and then at the end of the night, take it home, wash everything in hot soapy water? That's a way to cut down time and be efficient. If they need extra time, I'd suggest that they talk with their supervisor about the options. I have found that some employers are very accommodating, that if they need an extra 10 minutes, okay, you heard from the agriculture company. They were giving people extra time and not having them clock in or clock out. And they also did not penalize them if they had lower production of picking, knowing that they're taking pump breaks and that's the cause. So they're not going to be the first people to go based on production counts. So picking of fruit. So the employer also, and some other things that people have suggested is that the employee come in a little bit later or come in a little bit earlier, leave a little bit later to make up for time that they need. But the employer can't make the employee do this. Maybe there's an opportunity if they have an hour lunch to take a shorter meal break. Could they add some of that time on to their break, their pumping break? If it's a 30-minute unpaid meal break, that's kind of hard to, take time away from there. You do want them to eat. And the employee, maybe if it's really going to deduct any time from their pay, if that's what it's coming down to, do they have any extra vacation time, any leave? I would just have the conversation with your employer. If they understand what's going on and see the benefits to them, that, oh yeah, they don't miss work as often because the baby's not sick, and they're a happy employee and they're doing a great job. Maybe they'll see that giving a few more minutes their benefits are going to come back to them. So some companies do not track time taken as extra time taken, as long as employees don't abuse that time. And you saw that Ryder Berry Farms was one of those. So on to lack of support. So let's say they're back to work, they have their break time, their space. I would encourage the lactating employees to talk with their supervisors about how things are going. Often supervisors, they don't realize what the employee needs in the way of support, and they're not aware of how their actions or coworkers affect them. Maybe they're saying inappropriate things, or people are just making it harder, or they're not wanting to cover them for something. So provide your clients with resources to help them talk with their supervisors. And I would suggest they focus on specific concerns and specific requests. So if it's lack of privacy or sufficient time to express, those are the things covered by the law. They're also, they're covered by other laws too, retaliation, harassment, that all comes in to that also. So one thing I didn't mention, there's a hardship exemption. Moving on, that employers with fewer than 50 employees, they don't have to follow the break time and space requirements if compliance with the law would impose an undue hardship, but it's a very high bar. And they just can't say, oh, we can't do this. So the way undue hardship is determined is by looking at the difficulty or expense of compliance for a specific employer in comparison to the size of their business, the financial resources, the nature of their business, and the structure of the employee's business. All employees who work for the employer, regardless of the work site, they're counted when determining this if this exemption applies. So sometimes I'll hear where people say, oh yeah, they have 50 or less employees, they don't have to do it. That is not true. They still have to provide lactation accommodations. They have to make the attempt. If they don't, then an employee can make a claim for saying my employer is not providing this. Then the agencies that they complain to would come in and they come in and see what's going on and let that employer know, oh, no, actually you can do this. This is not an undue hardship. So it's not for the employer to determine that. Unfortunately, it's based if somebody complains. So we'll go on to the next one. I wanted to dispel this myth of the complaint process and that it's scary, and just show you an example of a mom that I helped in who actually made a complaint.
Hi, Veronica.
Hi.
So Veronica, tell me what happened at work after you had your baby.
Well, after work I came back and they told me that the only place I could pump is in the bathroom, and I kind of just like dealt with it for a while until one day like I was pumping and the door was locked, and then another employee grabbed the bathroom key, it's the spare one, and they just opened the door on me. And then after that I talked to my employer and they said that's the only place I could pump at was the bathroom.
How did that make you feel when somebody walked in on you and you're pumping?
I was so embarrassed, even though it's not anything you should be embarrassed about, but it's like your body, it's your privacy. But yeah.
Or after the person walked in, what did you tell your employer?
I told my employer that I didn't feel comfortable and that I need to pump because it's for my son, and they said that's the only place that is available for me at work. So,
and then what happened?
And then I contacted WIC, and that's when they stepped in and like gave me my rights and the flyers and all the paperwork that I needed to show them.
And so what did you guys end up doing?
Yeah, sorry. So I ended up having to call Department of Labor, and they came to my work and they talked to my employer, and then they told them that they need to change this and they need to find a proper place for me to pump.
How did you feel about making a complaint and calling the Department of Labor when your employer didn't accommodate you?
At first I was a little scared, but then afterwards I felt like very proud, because for other mothers coming, they don't have to deal with these same problems that I have to do. They can pump comfortably and they don't have to deal with anything that I had to.
So after Department of Labor came out, what was the resolution?
I was able to pump in an office, a locked office, and I had a big sign that says don't enter, and I felt a lot more comfortable pumping at work.
And some people are afraid to complain about when their employer doesn't follow the law. And so were there any problems after that?
No, there was no problems, no animosity or anything, and I say just definitely stand up for yourself, because you, for one, need to be comfortable so you can actually pump comfortably and make enough for your child, and it's just your rights. You should be able to have all this.
Anything else you want to share?
Yeah, I would just say stand up and fight for what you deserve.
Thank you. She was pretty brave to do that. So this is the how to file, and this will be in your handout. So this is the Department of Labor. You don't have to memorize any of this, but it will tell you what are the things you need to have. And a third party can call. Actually, I called for her and waited on the phone. I left a message, and they did get back to her. And I just followed the process, what was on this website. The Federal Department of Labor reacted very quickly, but there's more than one place that you can complain. So on the next slide, it will show you that in California, so they can complain to all of these places, actually. They could make a wage claim. And this is, so if they feel that their employer is not providing them with adequate break time or a place to express milk, they can file a wage claim to cover an hour of their hour premium pay at their rate. And on the next slide, it shows there's another place they can complain in California, file a claim. So additionally, the lactating employee may also file a report claim with the Labor Commissioner's Bureau of Field Enforcement. They call it BOFE office at the nearest place of their employment. And I put a link to this site in your handout. And the Labor Commissioner's office will also do an inspection. I'm just not sure how fast they'll reply at this moment. I do know that the the Department of Labor will come out actually really quickly. But somebody can just make complaints at all of these places, all of these agencies. And we do have, I do say that any retaliation, they feel like they're being retaliated, that's another place they can complain. So there are a lot of protections for people. They are protected. And so we have a guide at the California Breastfeeding Coalition. We are dedicated to ensuring that every lactating parent receives the support and accommodations that they need in the workplace. And in order to continue that support, we've developed a comprehensive guide designed to help you support those who face inadequate lactation accommodation at work. And this link is also in your handout. And I just want to thank you very much for your interest in this issue, in your time. And if we have time, we'll take questions or we'll wait till the end. So I'm happy to do either.
Thank you so much, Robbie. This was such a beneficial presentation. You shared a lot of really great info. We do have just a couple questions for you. So the first one is regarding the pumping tents for the field workers. Someone asked if there's a similar video for people that work in the restaurant industry.
There is. So in your handout, there's a link, and we have all the videos on the website, on the California Breastfeeding Coalition website. So you can scroll down, I think I put scroll down to the bottom, and you can see all the videos, because they are to target employers, for employers to see like this is actually possible. So it's really appropriate for employers or for an employee to share with their employer. There's lots of different examples.
Thank you so much. Okay, and the next question we have for you, this was regarding the lactation space. Someone asked, can the sink be in the common break room, or does it need to be near the lactation room?
It can be in the common break room. Right now it just says access. It does say in close proximity.
Okay, thank you. And then the final question is, what if the workplace is short-staffed? Do I still get time and a private place to pump?
I believe you do. That would be a good legal question, but it is up to your employer to accommodate you. So they have to make every effort possible. I think it would just depend on what kind of workplace it is. You know, the nature of that business.
Great, thank you. And I did see just two more quick questions come through the chat asking about the handouts, if they're accessible online. Are they on the California Breastfeeding Coalition website?
Yes, there are a lot of handouts there, and you'll see, I mean, even BreastfeedLA has handouts, so there's lots of information for everyone to learn about rights. I provided you with several, our website, BreastfeedLA, And so read all of them. There, you'll become the experts in this and advocate for the people that you work with. In the handout so you'll get a handout, will be later, Anna, the handout, and it has all the links.
Mm-hmm. Yes, and then actually, I'm sorry, one more question just came through the chat. Are these laws for companies with up to a certain number of employees, or
No,
definitely for California employees?
Yes. It's only one is they may be exempted if they have 50 or less, but it doesn't mean they aren't, like, they have to attempt and they have to do it.
Great. Well, thank you so much again, Robbie, for your great presentation. We really appreciate all of your time, and we'll definitely be sending out presentation slides and any additional handouts after this webinar. We are now going to move on to our friends from the California Work and Family Coalition. I am excited to introduce Jasmine Amian and Angelica Andrade. Jasmine is the Education and Training Manager for California Work and Family Coalition. Jasmine began her journey in education and serving the community as a City Year AmeriCorps student mentor in Los Angeles. Her experience in teaching inspired her to teach abroad for 2 years in Taiwan. In her role as a learning experience designer at EL Education, she helped educators learn curriculum foundations by crafting supplemental online training. She also built and managed a virtual learning support group within her Instructional Design Academy, fostering community building and knowledge sharing. I would also like to introduce Angelica Andrade, who is the Administrative Assistant and Spanish Training Coordinator for the California Work and Family Coalition. Angelica, during her time as at the public library in Los Angeles, she became very passionate about community work and providing people with the resources they needed, specifically to individuals who only spoke Spanish. As a Mexican American, she understands the language barriers the Latinx community faces. Now at the coalition, Angelica works to raise awareness and utilization of paid leave among the Latinx community. So Jasmine and Angelica, welcome. We'll turn it over to you.
Awesome. Thank you for the warm welcome, Laurel. And also thank you again to Robbie for getting into all of the lactation rights that everyone should know. So we really appreciate and thank you for having us be part of this collaboration. And so we all need to take paid leave at some point, either for ourselves and our loved ones. And our goal of today's training is to help you understand paid family leave, paid sick days, and all the relevant laws so that you and the families that you work with can exercise your rights. So that's our goal for today. A little bit more about California Work and Family Coalition is that we were founded in 2002, and we're a statewide alliance of organizations united through advocacy, education, implementation, and making sure we fight for all people to have the time, resources, and support systems to care for themselves and their biological and chosen families. So our agenda for today is to kind of, like I said, go over sick and safe days, paid sick and safe days, go over the basics of California's paid family leave program and the state disability insurance, all the eligibility and application requirements around that, as well as the job protection laws, and also to kind of talk about some of the positive impacts of paid family leave, as well as the barriers. And so we're going to go ahead and start off with one aspect of paid leave I think most people understand. We'll start with the sick and safe days. And before we jump in, let's just go ahead and do a quick stretch. Really appreciate you all being here. I know really appreciate having you guys be here for like 2 hours in your day on a Tuesday morning. So yeah, quick stretch. And we're going to go ahead and start off with a quick poll. I believe this is the slide 40 poll. In California, how many sick days in a year at minimum do you think you get for work? If you could go ahead and vote there. Is it 0 days and 0 hours? Is it 3 days and 24 hours? Is it 5 days or 40 hours? Or is it 10 days and 80 hours? What do you think? And then I'm also not sure the percentage. I can't see it on my end.
We're at about 66, 70% right now.
Okay. Awesome. Appreciate your participation. Okay. And then I guess we can close out that poll. I'm not sure if I'll be able to see the results, but okay, great. Awesome. So 2% said 0 days, 31% said 3 days, 51% said 5 days, and 16% said 10 days. So if you're part of that 51% who said 5 days or 40 hours, you got it. It looks like most of us already know this, but we wanted to spread this news because of a bill that was signed into law last year that states that starting this year, that number goes up from 3 to 5 paid sick days. Okay, thank you. So yeah, all California workers working 30 or more days within a year must be given up to a minimum of 40 hours or 5 days of paid sick and safe leave per year, whichever is more. And that's just the minimum, but that number can vary between different workplaces and different cities, and employees can be given more than just the 40 hours or 5 days. You'll have to look it up in your local city ordinances. Like, for example, LA gets 6 days or 48 hours. And you also can decide how much paid sick time to use at once. You could take a half day at work, but your employer can require you to use at least 2 hours at a time. And the eligibility requirements around that is that employees must accrue 1 hour of paid sick leave for every 30 hours worked and must have been employed for at least 90 days and worked in California for 30 days. When it comes to your sick days, your employer's responsibilities are that they must pay you 100% of your regular rate of pay when you're using those days. They cannot deny requests for paid sick days. They can't require you to find a coworker to cover your absence as a condition of using leave. And they can't require documentation like a doctor's note as a condition of using the leave unless you take 3 or more days in a row. And they also don't need to know why you are using your paid sick days. Those days are your days to take. On the other hand, though, your responsibilities as an employee is that you should notify your employer as soon as possible when you know that you need to use those paid sick days. And as it comes for everyone, with unanticipated illness or a medical emergency, it's okay to notify your employer as soon as it is practical. That someone can suddenly end up sick, and it's okay to just take your sick day if you need it. Okay, so that's the gist on sick and safe days. And in this next section, we're going to get into an overview of paid family leave and state disability insurance, which is the whole safety net piece. And kind of before we get into it, just to kind of clarify what's the difference between paid sick days and paid family leave and disability leave is paid sick days is more so used for short-term leave needs such as flu or COVID, or if you get the cold or some other sickness. If you have medical appointments, whether that's preventative care, like your annual checkups, or for a diagnosis, care, and treatment of existing health condition. And the other thing that paid sick days can be used for that is lesser known is to be used for safe days, to seek safety for reasons related to domestic violence, sexual assault, or stalking. As for paid family leave and disability leave, this is used for longer term leave needs, such as cancer treatment, recovering from surgery, giving birth, caring for a seriously ill family member, or bonding with a new baby. And also just to clarify, for paid sick days, that can be used to take care of yourself or for a family member. And then I'll get into more details about for paid family leave and disability leave in the upcoming slides. Okay, so to get more in depth, what exactly is disability insurance and paid family leave? Well, in this image that we see here, these are two halves of a whole program. Disability insurance and paid family leave are both wage replacement programs funded overall by the State Disability Insurance Fund, which are essentially funded from your paycheck as an employee, and which is your money and your right to take as needed. And this is specifically for employees who pay into the California State Disability Insurance Fund. Okay, so employees who pay into the State Disability Insurance Fund do receive partial wage replacement or partial pay when they can't work due to the qualifying reasons. And so for state disability insurance, it's when you're unable to perform your regular work due to physical or mental injuries, illnesses, or other health-related conditions, which can include elective surgery, pregnancy, childbirth. And in case you were curious about what is considered as a disability for SDI, you can check this link later on when we send you the slides from Legal Aid at Work, which Robbie mentioned earlier, which has a whole fact sheet on state disability insurance there. And then also for paid family leave, you can get partial pay as a parent to bond or care for a newborn, which I feel like most people know, but also if to bond with an adopted or a foster child, which is a lot less known. We also want to highlight that paid family leave can be taken as a caregiver to care for a seriously ill family member. For caregiving, that can include whether someone has like chronic illnesses or disabilities, taking care of someone for their daily needs, for someone who's unable to care for themselves. And that can include tending to physical and emotional needs of someone who requires continual support and attention. But this family member must be a spouse, domestic partner, parent, parent-in-law, child, sibling, grandparent, and grandchild of the person who requests leave. And our advocacy side is working to expand that definition of family. But as of right now, these are the specific family members who you can take paid family leave for as a caregiver. Lastly, you can take paid family leave in specific situations related to the military deployment of your child, parent, or spouse. And so one of those frequently asked questions that we get is, what is the difference between workers' comp and state disability insurance? Well, workers' comp provides benefits for a worker with a work-related injury or illness. So say like you're doing something on your job and you trip and you sprain your ankle at work. That would be covered by workers' compensation. Versus state disability insurance provides partial wage replacement to eligible workers for a non-work-related illness, injury, or pregnancy. And so I know that was a lot of information. So just to break it down a little bit more, especially for more visual learners, at the top, you can see in yellow on the top row, which is covered by disability insurance, is for your own long-term health condition or a pregnancy-related condition. And in red on the bottom row, covered by paid family leave, is for parents to bond and care for a new child, for caregivers, caring for a ill family member, assisting with daily living activities such as transportation, monitoring medical conditions, managing medications, or other things of that nature. And then lastly, for families with family members serving in the military. Okay, so I'm sure there's more questions about like what's considered a serious health condition. And so that what most commonly includes these type of conditions as covered by the Paid Family Leave or the California Family Rights Act or Family Medical Leave Act is one, requiring an overnight stay in a hospital or other medical care facility. Two, debilitating you or a family member unable to attend work or school for more than 3 days and requiring ongoing treatment, including doctor's visits or prescription medication. Or three, chronic conditions that cause periodic incapacitation, such as migraines, asthma, or fatigue, things like that. Yeah, so now that we've classified what a serious health condition is, going over what are the eligibility requirements for both state disability insurance and paid family leave. On the left here, for state disability insurance, you must be unable to do regular or customary work due to your own serious illness or disability, which includes pregnancy. And for paid family leave, you must have a new child or need to care for a seriously ill family member, and you must take this leave within the first year after birth or placement. And so the conditions for both are you need to be paying into state disability insurance, and you must be in the labor market and must have suffered a wage loss. So for that, you must apply promptly and have been working or looking for work when the disability began and have sufficient past earnings in your base period. So earned at least $300 from which the SDI deductions were withheld during the base period. So how you can check this is also by going to the EDD website. And this is a link here that will calculate your paid family leave and SDI based on your monthly income. It would calculate how much you would receive. And that resource would be shared later on too. And I'm sure you're asking, well, Jasmine, how would I know? How would I know if I'm contributing to the state disability insurance fund? Well, what you would do is you would grab your pay stub or your paycheck and check to see that the taxes withheld are under CA state disability insurance. And it can also appear as CASDI. And if you're paying into that, then you know that you are contributing to the SDI fund and are entitled to get paid family leave or state disability insurance. And does an employee have to work a minimum number of hours or days before becoming eligible for paid family leave or state disability insurance benefits? The answer is no. You do not have to work a minimum number of hours or days to be eligible for paid family leave or SDI, and the amount of benefits you receive is determined by your earnings in the base period, not by the number of hours or days worked, unlike paid sick and safe days. Okay, and so the benefits from paid family leave are that right now most employees, right now you can receive partial wage replacement, which is 60 or 70% of normal weekly wages. But unfortunately, most employees don't qualify for the 70% wage replacement. But starting next year, that will be changing, which we'll be getting into in the next slide. And the max number of weeks that you can receive state disability insurance is 52 weeks, but that would be for a fairly catastrophic situation. Most of the time, most people take less than that. And then you can receive paid family leave for up to 8 weeks within a rolling year. So if you started tomorrow, you'd have a year to take up to those 8 weeks. And you can take that leave all at once or break it up into parts, either hourly, daily, or weekly. And you can apply through the EDD website within 49 days or later with good cause. Okay, so many people were finding themselves in situations where they needed to take that leave, but couldn't afford to take that time because 60% of their wages just wasn't enough to cover paying for their rent or mortgage. So next year, starting January 1st, low-income workers in California will be able to receive 90% of their regular wages from state disability insurance and paid family leave. Low-income workers will be defined as anyone making 70% or less than the state average weekly wage, which is equivalent to $60,000 a year in 2024, this year. And other workers will receive up to 70% of their regular wages up to a cap. And from this point, I'm going to go ahead and hand it over to Angelica to lead us in our next poll.
Thank you, Jasmine. Yes, if we can launch the poll, Anna, please. So the question is, can an undocumented worker take state disability insurance or paid family leave? And your options to answer the question are yes or no. What is the current participation?
What about 65%?
Okay, let's try to get to 70 at least.
Okay, I'm gonna end the poll now.
Okay, so we kind of have a tie here. So we see that some people answered yes, it's 58%, and then 42% answered no. So the answer to this question is yes. So as long as an undocumented worker is paying into the California SDI fund, they are able to access both of these programs. And I think something important that we didn't know previously is that if you are taking if you need to care for someone outside of the state or outside of the country, you are able to do that as long as you are an employee here in California paying into the fund. So it is important to note that citizenship and immigration status do not affect the eligibility of state disability insurance and paid family leave benefits. Next slide. So we do recommend that if you are an undocumented worker or working with undocumented workers, that when it comes to filling out the application, you kind of go over this resource from Legal Aid at Work. This resource is extremely helpful to help an undocumented worker apply for both of these programs. And this resource is also available in Spanish. It is hyperlinked here, so we will make sure to share the slides and you'll have access to all the links. And again, this is from Legal Aid at Work, and they do also offer a free helpline, and their phone number is provided here. Next slide. So now moving on to the application for both state disability insurance and the paid family leave program. So you can apply online or by mail. If you do apply online, you will create a one-time benefits program account on the EDD website. You'll also input your basic personal information, and then you'll input your employer information. And where it differentiates, it's based on what program you are taking. So if you're taking state disability insurance, you will need to provide documents that are verified by a physician or a medical provider. If you are taking paid family leave to bond with a new child, your application will require proof of relationship, except if you are the birthing parent and already took state disability insurance, the application will go through. You'll still need to apply, but all your documents should be there. If you are the non-birthing parent, you will have to share proof of relationship, and an example of that would be the birth certificate. And then for paid family leave for caregiving, you will have to share care recipient information. So a frequently asked question we get is, can my partner and I both use paid family leave to bond with our new child? So the answer is yes, both parents can use paid family leave to bond with the new child. However, you do not have to take it at the same time. So if one person wants to take it first, then the non-birthing parent can take it after, or vice versa. It really just depends on your situation and your family. Oftentimes we do hear that parents do kind of take it separately just to help, because again, you do not receive 100% of your pay, you only receive 60% of your pay.
Oh, and Angelica, there was a clarifying question in the chat. Does undocumented mean working under the table?
Not necessarily. Undocumented means not having legal status. So yeah, if you're working under the table, I can't answer that because I'm not too familiar with that, but you could seek legal help to see kind of if you could still qualify for these benefits. Next slide. So paid family leave, so for those who are not eligible, so there are many organizations who do not automatically pay into the California SDI fund, as they may have their own paid leave program. And some of these workers are government and federal workers, independent contractors, self-employed, or freelance. So it is important to speak to human resources or a union representative to understand the paid leave rights at your job if you're not eligible for these programs. And then if you are an independent contractor or self-employed freelance worker, you can opt in to the California SDI fund through the Disability Insurance Elective Coverage. And this is a program provided by the EDD. So it is also very, very important to note that if you that paid family leave is a wage replacement program only, so it does not require your employer to give you your job back when you return from leave. And so now we're going to go over job protection. There are 3 job protection laws: CFRA, PDL, and FMLA. So what is job protection? There are state and federal laws that protect your job while you are on leave. However, your employer is only required to do so if you are covered by these laws. If you qualify for job protection, your employer must guarantee your job or a comparable job when you return from leave, and they must maintain your benefits during your leave. And it is against the law to refuse a request or retaliate against you for using or attempting to use your leave. So now here we can see the job protection law. So on one side, we can see the entire United States, where we have the Family Medical Leave Act, also known as FMLA. And this law does apply to everyone in the United States, or everyone working in the United States. And then on the other side, we have the state of California, where we can see the California Family Rights Act, also known as CFRA, and Pregnancy Disability Leave, also known as PDL. And these 2 laws apply to California only. So in this training and in most of our trainings, we do focus on CFRA and PDL because they are stronger laws than FMLA. They cover and protect more California workers. So here we can see the eligibility requirements for CFRA. There are 3 eligibility requirements that an employee must meet to be protected. So the first one being 1 year on the job. The second one is you must have worked at least 1,250 hours in the prior year. So this is around 25 hours a week. And number 3, work at an employer with 5 or more employees. And for pregnancy disability leave, there's only one requirement, which is that you work for an employer with 5 or more employees. It does not matter how many hours you worked or how long you've been with that employer. As long as there are 5 or more employees, your job will be protected if you are pregnant. So and this leave provides up to 4 months of unpaid job protected leave while disabled by pregnancy, childbirth, or a related condition. And this can be used for prenatal care, can be used intermittently, so you do not need to take it all at once. And the continuation of health benefits must continue while you are on leave. And for an uncomplicated pregnancy, PDL is typically 4 weeks prior to estimated due date and 6 or 8 weeks after birth. 6 is usually for a vaginal delivery and 8 is for a C-section. Now here we wanted to add a visual of how these how both wage replacement and job protection work together. So this is an example of a parent who is eligible for both PFL and CFRA, meaning they can receive benefits from paid family leave, and their job will be protected while they are on that leave. So at the bottom in yellow, we can see that the California Family Rights Act provides a total of 12 weeks of job protection to bond with the new baby. And out of those 12 weeks, 8 of them are paid by the paid family leave program. So only 8 are paid at 60 or 70% of your pay, but you still have the remainder of those 4 weeks under the California Family Rights Act. So you are able to take those 4 weeks if you want to. You just would not receive any wage replacement from the paid family leave program. And in this example, we have a pregnant worker who is eligible for state disability insurance, the Pregnancy Disability Leave Law, Paid Family Leave, and the California Family Rights Act. And this is an example of an uncomplicated pregnancy. So to start off, we'll start with the pregnancy side. So we see in the bottom in yellow, the pregnancy disability leave, it's up to 4 months. However, this is for an uncomplicated pregnancy. So assuming that they don't really need the 4 months, right? So they'll take their 4 weeks before their due date, and 6 or 8 weeks to recover, depending on how they delivered the baby. So this is approximately 10 to 12 weeks. And that would also be paid through the state disability insurance program. So those 12 weeks are paid through the state disability insurance program and are protected under the pregnancy disability leave law. And then once they're done with the state disability insurance program, they'll move on to paid family leave, which is a total of 8 weeks of paid family leave. And those 8 weeks are protected under California Family Rights Act. And again, they can take the 4 remainder of those weeks, but they would just be unpaid. And so if you do not qualify for job protection, you can still use both of these programs, state disability insurance and paid family leave, as long as you pay into the California State Disability Insurance Fund. You can ask your employer to hold your job while you are on leave, but unfortunately, your employer is not legally obligated to hold your job while you are on leave. And so there are multiple steps to ensure your rights. Talk to your doctor and or medical provider, talk to your employer or union representative. You can also talk to the EDD. And then I think one important thing to point out is to always document your communication. Make sure you get everything in writing so that there is a record of it, especially when you are requesting that leave with an employer. And yes, I just saw the question, are we able to get a copy of this PowerPoint? Yes, we will share the slides so that they can be shared with all of you. And also all the links are here, so you're able to access all the links.
And then Angelica, I saw one other question from Jenilyn asking, can a pregnant woman who quit her job still receive SDI?
Yes, so as long as they've previously paid into the California SDI fund, they can still take SDI. And as long as they're able to be on the labor market, which they would be after giving birth, so they could still apply for SDI. They just need to make sure they've paid into the fund.
Awesome. Thanks, Angelica. Okay, so I'll get into the positive impacts of paid family leave and as well as the barriers. So many studies have shown that paid family leave lowers infant deaths. It increases the number of babies attending their well baby visits and getting their vaccinations. And it increases the number of people who breastfeed and extends the amount of time that people breastfeed, which helps lower the rates of infection and SIDS. It also enables parents to be home with their baby during the most critical time in a baby's life, as I'm sure you all know, because a baby's first 12 weeks are critical for brain development and shapes the way a child interacts with their surroundings for their entire life. Also, it allows workers who are caring for a family member to remain in the workforce. It helps to close the pay gap between men and women. It increases the number of people receiving preventative care, which lowers long-term healthcare costs, and is associated with a decrease in nursing home stays for older Californians and improved health outcomes for children with chronic diseases, and promotes economic independence that is a preventive factor against interpersonal or intimate partner violence. And something that's surprising to many people is that the US is the only developed nation in the world that does not have a national paid family and medical leave program for its citizens. In 2018, it was only 14% of US workers who had access to paid family leave. And in 2023, last year, only 27 of private industry workers had access to paid family leave. And that's really unfortunate because like everyone deserves to have that time to take care of their family or themselves. So what we're doing is organizing and advocating to change this. We're trying to expand the law through advocacy by sharing our stories with legislators. And something I want to kind of highlight is it was until 2022 that paid family leave was able to pass in California, and it was the first state to pass in the US. But it wasn't until 2024 that people could take paid family leave for the first time. And I think we're coming on to our 20th anniversary now of being able to take paid family leave, but definitely still working to close those gaps because we know that there's a lot of barriers to paid leave, especially the lack of awareness, especially amongst communities of color, especially BIPOC families, and then also for non-birthing parents. A lot of times those who are fostering or adopting children don't know they can take paid family leave, as well as caregivers. So we definitely want to make sure that you know that you can take paid leave as a caregiver. Another barrier is administrative barriers, which is there is a low take up amongst new immigrants and monolingual Spanish speakers. And we know that the application can be difficult to navigate at times, as well as policy barriers, which is wage replacement not being enough for low-wage workers. There's that limited definition of family, which impacts LGBTQ plus and immigrant communities with extended families, and that most public employees are not included in this law. So our goal for our coalition is to move toward a federal paid leave law, and we are working with national and state partners to build momentum for inclusive federal paid leave law. And so I'll go ahead and hand it over to Angelica to talk about the resources and let you know how you and your organizations can get involved.
Thank you, Jasmine. And if any of you have any other questions, please feel free to put them in the chat. So how can you and your organization get involved? So you can join the California Work and Family Coalition newsletter. We share updates on our upcoming education and advocacy events. And then if you have any questions or want to get more involved, you can always email us at info@workfamilyca.org. And here we do have our resources, so you can learn more about paid leave, your rights, and how to advocate with us on our paidfamilyleave.org website. We also have resources hyperlinked to better help understand paid leave, resources for new parents, and resources from the EDD. And we also have our resource hub that you can find out on our workfamilyca.org website. And here you can find resources based on the reason why you need to take leave. So if you're taking leave to care for someone, you would go to that specific section. And we've talked about legal aid at work a lot, but we really do recommend reaching out to legal aid at work if you feel your rights have been violated and need legal help. They do provide free legal services, and they also have a work and family helpline, so you can contact them. You can contact them by phone, or they do have a written option, so we hyperlink the website, and then they are available in English, Spanish, Cantonese, Mandarin, and other languages. And thank you all very much. We were so happy to be here with all of you. And if you do have any questions, please feel free to put them in the chat. I do see one question about paid family leave for undocumented parents, if it'll affect them in the future when they want to apply for legal status in this country. So we do recommend that you reach out to Legal Aid at Work if that is something that comes up like a concern for those folks. We can't really speak on it. We cannot give legal advice. So the only thing we can say is that we recommend that they reach out for legal support for that situation. Oh, and I can pass it back to you, Laurel, if that's okay.
Yes, of course. Thank you both so much, Jasmine and Angelica. This was another really important, really valuable conversation we had. You guys did a wonderful job keeping up with your questions in the chat. You've answered every question that came through. I would like to highlight one question that came through in the Q&A that Angelica answered, but just to make sure that everybody saw it. So someone asked, if the woman is unemployed but had paid into SDI, does it have to be the same year or time frame, i.e. worked in 2023 into early 2024 and now in May is unemployed? Angelica said, yes, I believe that that is based during the time period of the pregnancy. That was a really interesting question. Thank you for answering that for us, Angelica. If there are no other questions coming through in the chat, which like I said, I think you guys did a really great job keeping up and answering all those questions for us. Thank you. In that case, we will move on to our LABBN evaluation. As you all know, we love our evals here. They are very, very helpful for us in planning our future webinars. So I'm going to go ahead and put our QR code up, and I'll drop the link in the chat for you all. But if you could all just take a couple minutes, really, really fast webinar evaluation would be very helpful for us. Let me drop this in the chat really quick here. And while I'm putting this, if you do have any other questions, please feel free to also drop those in the chat for us. The link for the SurveyMonkey is there. All right, please let me know if you have any trouble accessing. Yeah. Great. Well, once again, I just want to say thank you to all of our presenters. You guys are truly experts in your field. We really, really appreciate you spending the time to share with our workforce that are really going to be able to help families directly. They're going to be able to support their families better because of all this information that you provided today. So thank you once again. Everybody, please give our speakers a virtual round of applause. Thank you all so much. You're getting lots of hearts and love coming through. Thank you, guys. All right. And, oh, Anna, I see your hand up.
That was an accident. I'm so sorry. I was trying to celebrate and then I accidentally raised my hand. Thank you again. Thank you everyone for joining us today.
Yes, and we will definitely be sending out all of our slides. We'll share the recording out, and then any additional resources that were shared during this webinar will also be shared with anyone who registered today. All right. Oh, Maribel, Jasmine added a response in the chat. I'm not sure if you can see it. It says, turns out that it is a frequently asked question. Using PFL or sick days should not affect their naturalization application. Correct, it should not, but I do know that that is a common concern for a lot of families that are in the process of becoming citizens. So thank you so much for looking that up so quickly, Jasmine. Very, very helpful. And again, yeah, thank you. I think we're all good. Thank you all so much for joining us today, and keep your eyes open for all the follow-up materials. Thank you all so much.
Thanks,
Thank you, everyone. Have a good one.